Hello, welcome to Mind Matters with Dr. Gochukwu Ojiako. In the second series of anxiety disorders, we discussed panic disorder, its presentation, diagnostic criteria, clinical management, and comorbidities. If you have not watched the first and the second series already, you may want to do so in order to better understand our upcoming series on the different types of anxieties. So today we'll be discussing generalized anxiety disorder, also called GAD. Generalized anxiety disorder is a type of anxiety disorder that causes worry, apprehension, and anxiety about different events and activities. The worry and anxiety occur more days than not within a period of at least 6 months. Many people experience anxiety about stressful situations like public speaking, taking an exam, and interviewing for a job. However, persistent increased anxiety symptoms that impairs one's functioning may actually indicate generalized anxiety disorder. People experiencing generalized anxiety disorder find it difficult to control their symptoms. Often, there's no link with life events and stressors. The anxiety and worry impacts activities of daily living. The nature and the focus of the anxiety changes frequently, and the symptoms worsens with increased stress. So, assessment to diagnose generalized anxiety disorder focuses on collecting history to assess the following. If the worry and the anxiety are disproportionate to the actual event that is causing the anxiety. If the individual reports distress related to the excessive worry. If symptoms occur more days than not within a period of 6 months, and if the individual has difficulty controlling the anxiety. Of course, after collecting history, it is very important to rule out other health conditions that present with similar symptoms, such as post-traumatic stress disorder or PTSD, adjustment disorder with anxiety, obsession in obsessive compulsive disorder, and other types of anxiety that present with similar symptoms, such as social phobia. Physical exam findings are usually non-specific. Findings may actually be associated with other health conditions such as IBS or irritable bowel syndrome, migraine, or other types of headache. Physical symptoms of anxiety includes muscle soreness, muscle ache, muscle tension, tachycardia, dizziness, numbness, trembling, increased respiratory rate, and sleep disturbance. Mental status exam often shows restlessness, feeling on edge, irritability, and difficulty concentrating. Comorbidities of generalized anxiety disorder or other conditions that can coexist with generalized anxiety disorder are mood disorder, other types of anxieties, and substance-related disorders. Clinical management of generalized anxiety disorder involves medication treatment and psychotherapy. It can be medication by itself or psychotherapy by itself or combination of both. Some of the therapies that can be used in the treatment of generalized anxiety disorder are CBT or cognitive behavioral therapy, stress management, relaxation therapy, and supportive counseling. Of course, your mental health professional will work with you based on assessment to determine the best treatment plan for you. So, I want to bring attention to children here when it comes to anxiety. It is something that is very common among children. So, it is important to note too that they can also experience pathological level of anxiety. In children, anxiety often manifests as being excessively worried about their competence or performance in school, in sports, and other activities. Also, sometimes their anxiety manifests as being overly worried about punctuality in school or catastrophic events such as earthquake or war. It is very important as parents, teachers, or adults that interact with children on regular basis that we pay close attention to the kind of anxiety they experience. It is essential that if we notice anything that is abnormal or extreme, that we bring this to attention of an adult who is responsible for the child so they can be properly assessed and treated. So in our future videos, we will address the other types of anxieties, including social phobia, specific phobia, and agoraphobia. Our email address is located in the description. Please feel free to send us your general questions. We will randomly select questions to be addressed in our future videos. So like, comment, subscribe, and share this video with your friends and your families. Thank you for watching. I am Dr. Ogochukwu Ojiako. Thank you.